The important thing with scars is, as a surgeon, to pay attention to detail, put the scars in the right place, use the right suture, and spend time doing it neatly and beautifully. Some of it depends obviously on the patient's skin. The best way to really try and show patients what kind of a scarring is they're likely to expect is to show them past patients and their scarring. Naturally, the scarring is a process. It's not instant. When you stitch two bits of skin together, their skin goes through forming haphazard scar under the skin. That will form some hardness, some redness to the scar, and over time that will mature and becomes faint, thin white line and not hard at all. And that process can vary on people depending on their skin quality. So it's important to show stages of scars on other patients and to explain to the patient that this is how your scar is going to be at 1 week, this is how it's going to be after a few months, this is how it's going to be in a year. And naturally, that's a dynamic thing and it will change over time, but they get a rough idea of how long their scars may be visible for and how would they fade. It's important to also mention that because the scarring is around the face, that often patients want to hide it if the scar is still immature. The first 2 weeks, you can't really put any makeup or any camouflage on the scars because there's risk of infection. So in the first 2 weeks, they either need to hide away, or in ladies who have a longer hair, their hair would cover their scars and it wouldn't be visible. After 2 weeks, if their scars are a bit red, then they can be certainly camouflaged with some touch-up foundation or makeup.